Most people would never guess that you can retrain your nervous system to drop your blood pressure in just a few minutes a day without lifting a single weight. While most people focus on intense cardio, these 3 specific breathing techniques are proven to strengthen the heart, ease pressure on the arteries, and reduce the effort your heart makes with every single beat. Stay with me until the very end of this video, because the 3rd technique is the one that genuinely surprised me when I first read the research, and it may change the way you think about your own heart for good. And it may change the way you think about your own heart for good. Now, if you watched the video we made not long ago about garlic and blood pressure, you already understand something important. The real reason blood pressure keeps rising as we age is not simply about eating the wrong things or skipping walks. It is about what is happening inside the walls of the blood vessels themselves. They stiffen, they narrow, they become less responsive. And because of that, the heart has to push harder with every beat just to move blood through the body. That is the root of the problem. What we are going to talk about today approaches that same problem from a completely different direction. Not through what you eat, but through something you are already doing every single moment of every single day. Something you have never been taught to do deliberately. Your breath. There is something most people have noticed at some point without ever putting a name to it. When anxiety or stress arrives, breathing gets shorter and faster. The chest tightens, the shoulders rise, and blood pressure goes up. But the opposite is also true. When breathing slows and deepens, something in the body settles. The tension eases. The heart slows just a little. That is not imagination. That is the body's own internal system responding directly to the signals the breath is sending. And the science behind that response is far more powerful than most people realize. I am Dr. Natalie Brooks, and what I want to share with you today is something I genuinely wish had been part of standard cardiovascular care much earlier than it has been. I have worked alongside patients managing blood pressure for years, and one of the most consistent things I have observed is this. Most people are given a list of things to avoid and a prescription to take, but they are rarely given any tools that they can use at home, on their own, in under 10 minutes that directly influence how hard the heart has to work. These 3 breathing exercises are exactly those tools. They have real research behind them. They are completely free. These exercises are completely free for everyone to use. And for many people, they begin showing results within the first 2 weeks of consistent practice. Let me share something with you before we go any further. Most people have noticed it at some point without ever putting a name to it. Now here is something that makes this technique especially relevant for blood pressure specifically. Many older adults experience what is called the morning spike. The shoulders rise, and blood pressure goes up. But the opposite is also true. When breathing slows and deepens, something in the body settles. The tension eases. The heart slows just a little. That is not imagination. That is the body's own internal system responding directly to the signals the breath is sending. And the science behind that response is far more powerful than most people realize. Now, a quick word about what the heart actually needs from us as we get older. Think of the heart as a pump that has been running continuously without a single day off for 60, 70, or 80 years. That pump depends on the pipes connected to it remaining flexible and easy to push through. When those pipes, the arteries, remains soft and responsive. The pump does not have to work nearly as hard. When those pipes stiffen and resist, the pump strains with every beat. This is the core of what high blood pressure actually is. This is the core of what high blood pressure actually is. The heart working harder than it should have to because the environment around it has changed. What breathing does is influence that environment directly, and it does so through a part of your nervous system that most people have never heard of, but that controls far more of your cardiovascular health than you might expect. This system works like the body's own internal brake. When it is active, the heart slows, the blood vessels relax slightly, and blood pressure eases, and your blood pressure begins to ease naturally. When it is not active, everything runs on higher alert. Stress keeps the pressure elevated. Sleep does not bring the readings down the way it should, and the morning numbers are higher than they were years ago. The 3 breathing exercises you are about to learn are among the most evidence-supported ways available to activate that internal brake deliberately and consistently. This will help you activate that internal brake deliberately and consistently. And here is the most important thing about them. They do not require any equipment. They do not require you to be fit or healthy enough to exercise. They simply require a few quiet minutes and the willingness to try something that is already working for thousands of older adults around the world. Now, let us begin our very first exercise together. The first exercise is the 4-7-8 breathing method. And if that name sounds familiar, it may be because we touched on this technique in the breathing video we released earlier. But today I want to go deeper into why it specifically helps blood pressure and how to use it at the right time of day for maximum effect. Before we go into the techniques, leave a comment right now with your age and the country you are watching from. I genuinely read every single one, and I want to know how far this information is reaching. And while you are there, tell me whether you have ever tried any kind of breathing practice before, even just once, and what your experience was. Those comments tell me more about what viewers need than anything else. Now here is something that makes this technique especially relevant for blood pressure specifically. Many older adults experience what is called the morning spike. Where blood pressure is noticeably higher in the first 1 to 2 hours after waking than at any other time of day. That spike happens partly because the body is transitioning from its overnight state to its daytime state, and the nervous system briefly runs on higher alert during that transition. Practicing 4-7-8 breathing for just 4 to 6 cycles immediately after waking, before getting out of bed, before checking your phone, before any stimulation, directly interrupts that morning spike by activating the calming brake earlier in the day. Many people who have done this consistently for 2 weeks describe noticing that their morning readings have become calmer, not necessarily dramatically lower, but less sharp, less unpredictable, more like a gentle wave than a sudden jump. For the safety of older adults, particularly anyone managing blood pressure medications or with known heart conditions, The 7-second breath hold is optional. The 7-second breath hold is optional. If you feel any dizziness or discomfort during the hold, simply skip it and practice a 4-second inhale followed by an 8-second exhale. Simply skip it and practice a 4-second inhale followed by an 8-second exhale. The exhale is the most important part. You can gain the majority of the benefit from this technique through the extended exhale alone without the hold. Through the extended exhale alone without the hold. 4 to 6 cycles in the morning, 4 to 6 cycles in the evening before sleep. That is all it takes to begin. That is all it takes to begin your new heart health routine. Now let me ask you something. When was the last time you thought of your breathing muscles the same way you think of the muscles in your legs or your arms? The same way you think of the muscles in your legs or your arms. You would never expect your legs to stay strong if you never use them deliberately. Yet most people spend their entire lives breathing with only a small fraction of their respiratory muscle capacity, never challenging those muscles, never asking them to work at full strength. And as it turns out, the strength of your breathing muscles has a direct and significant impact on your blood pressure. This brings us to the second technique, and this one is the one that has genuinely surprised the research community in recent years. It is called inspiratory muscle training. And you do not need any special equipment to try the version we are going to describe today. The traditional version of this exercise uses a small handheld device that creates resistance when you breathe in, like breathing through a slightly narrowed opening. But the resistance can also be created simply by pursing your lips slightly during the inhale, similar to breathing in through a drinking straw. And that is the version we will use here. Here is why this works. When you breathe in against gentle resistance, your breathing muscles have to work harder to pull the air in. Over time, this is exactly like doing gentle strength work for those muscles. They get stronger. And when those muscles get stronger, something remarkable happens to the cardiovascular system. A study followed middle-aged and older adults who practiced 5 minutes of resistance breathing per day for 6 weeks. Their systolic blood pressure dropped by an average of 9 points. A separate 2025 study directly compared this kind of breathing training to 30 minutes of moderate aerobic exercise 5 days a week. After several weeks, both groups showed meaningful blood pressure reductions. The breathing group achieved comparable results in 8 minutes a day, not 30 minutes, 8 minutes. And adherence was significantly higher in the breathing group. Now, I want to be very clear here because this is important. These results do not mean that breathing exercises replace your medication, and they do not mean that exercise is not valuable. Both exercise and medication play important roles in blood pressure management, and neither should be stopped or reduced without your doctor's guidance. What this research shows is that breathing training is a genuine addition, not a replacement for what is already working, but a meaningful extra tool that adds something the others do not. To practice the resistance breath today, find a comfortable chair and sit upright with both feet flat on the floor. Take a moment to relax your shoulders and your jaw. Now, breathe in slowly through pursed lips, as though you are drawing air through a drinking straw, for 5 seconds. You should feel a slight effort in the muscles around your chest and ribs. That effort is exactly what you are training. Then breathe out naturally and comfortably through your mouth for 5 seconds. Repeat this for 15 to 20 cycles, which takes approximately 3 to 4 minutes. Rest for 1 minute, then complete a second set. 5 minutes of this practice, once or twice daily, is the frequency reflected in the clinical research. Many people find it easiest to pair this with something they already do every day, sitting with a morning cup of tea, resting after lunch, or sitting quietly before the evening news begins. If you are finding this video helpful, now is a good time to share it with someone in your life who is managing blood pressure and may not know these options exist. And if you have not yet subscribed to this channel, do it now so you do not miss what we release next. The third technique is called box breathing, and it is the one I most often recommend to patients who are dealing with anxiety and fear, alongside a difficult diagnosis. Because here is something that does not get talked about enough. The stress of having high blood pressure very often makes it worse. You worry about the reading. You sit down with the cuff. Your heart rate goes up just from the act of measuring. The number comes back higher than expected, and the worry increases. This cycle is real. Box breathing breaks that cycle in 2 ways at once. It directly lowers the body's stress response, and it gives the nervous system a calm, rhythmic pattern to follow that over time trains the heart's rhythm to become more stable. The technique is built around 4 equal parts, each lasting 4 seconds. You breathe in for 4, you hold for 4, you breathe out for 4, and you pause before the next breath for 4. Imagine drawing a square with your breath. Each side is 4 seconds. The visual is not decorative. It actually helps the mind stay focused on the rhythm, rather than wandering to whatever it was worrying about before you started. Research published in 2025 examining different controlled breathing patterns found that even ratio breathing techniques significantly improved heart rate variability, which is the medical term for how steadily and consistently the heart beats from one beat to the next. Good heart rate variability is one of the strongest predictors of long-term cardiovascular health, and it tends to decrease with age and with chronic stress. Box breathing, practiced daily, appears to help slow and even partially reverse that decline. To practice the resistance breath today, find a comfortable chair and sit upright with both feet flat on the floor. Take a moment to relax your shoulders and your jaw. Breathe in slowly through pursed lips, as though drawing air through a drinking straw for 5 seconds. You should feel a slight effort in the muscles around your chest and ribs during the inhale. That effort is exactly what you are training. Breathe out naturally through your mouth for 5 to 6 seconds. Repeat for 15 to 20 cycles, which takes about 3 to 4 minutes. Rest for 1 minute, then complete a second set. 5 minutes of this practice once or twice daily is the frequency reflected in the clinical research. Many people find it easiest to pair this with something they already do every day: a quiet morning sit, rest after lunch, or time in a favorite chair before the evening begins. Over 2 to 4 weeks of consistent practice, many people notice not just calmer readings, but that breathing itself has become easier throughout the day. To practice box breathing, sit or lie comfortably. Close your eyes if that is comfortable for you. Breathe in through your nose for 4 slow counts. Hold gently for 4 counts. Breathe out through your mouth for 4 counts. Pause before the next breath for 4 counts. That is 1 complete box. Aim for 8 to 10 complete boxes per session, which takes about 3 minutes. Practice once in the morning and once in the evening. Some people find it helpful to practice an additional short session anytime they notice their stress levels rising during the day, before a doctor's appointment, or during a moment of worry. The technique works both as a daily cardiovascular training tool and as an immediate calming response in real time. Now let us bring everything together into a simple daily routine that requires no equipment and takes less than 15 minutes total. When you first wake up, before you look at your phone or get out of bed, spend 3 minutes on 4-7-8 breathing. 4 cycles if you include the breath hold, or 6 cycles without. This addresses the morning spike directly and sets the tone for the rest of the day. After breakfast or during a morning sit, spend 5 minutes on resistance breathing with pursed lips. 15 to 20 slow inhale and exhale cycles with the slight resistance on the way in. This builds the breathing muscle strength that, over weeks of practice, contributes to the longer-term blood pressure benefits. In the evening, before dinner or before settling in for the night, spend 5 minutes on box breathing. This reduces the accumulated stress of the day, stabilizes the heart's rhythm before sleep, and supports the kind of deep overnight rest that helps blood pressure complete its natural overnight fall. The entire schedule takes roughly 13 minutes across the full day. It can be split, adjusted, and moved around to fit any routine. The only rule that matters is consistency. Because these techniques work by training the nervous system and the breathing muscles over time, not by producing dramatic changes in a single session, the research shows that meaningful results typically become visible within 2 to 4 weeks of daily practice. Not perfection, consistency. As you build this practice, there are a few markers worth paying attention to. Your morning blood pressure readings over the first month. How your readings feel compared to how they felt before, meaning whether they seem less erratic, calmer across the week. How quickly your heart rate returns to resting after any moderate exertion. And, perhaps most importantly, how your relationship with the measurement itself changes. Many people who commit to this practice for 30 days describe something that goes well beyond numbers. They describe feeling less afraid of their own body, less helpless, more like someone who is actively participating in their health, rather than simply waiting to see what the next reading says. That shift matters, because the person who feels capable is the person who keeps showing up. And the person who keeps showing up is the person who sees results. This is what Senior Health Advice exists to give you, the kind of practical, research-grounded guidance that a standard appointment simply does not have time for, delivered in plain language and built around what your body actually needs right now. If this video has given you something useful today, please share it with someone over 60 in your life. Subscribe to Senior Health Advice so you never miss what comes next. And leave a comment below telling Dr. Natalie Brooks which of these 3 techniques you are going to try first. Your heart has been working for you every single day of your life without asking for anything in return. These 3 techniques are your way of working for it.